Okay, for this video, I will go through our portion where we will do the breast and axilla inspection. This will be done at the completion of our exam. So to start, I will have my patient sitting. They will be sitting upright without a gown or a t-shirt on, so I can inspect the size and shape of the breast, just checking for symmetry, placement on the body, and I'll check the color, the vascularity, checking any bulging, dimpling, edema, or any signs of orange peel looking skin. When I'm inspecting, I'm seeing if there's any enlarged lymph nodes up in the axilla and clavicular area as well. And when they're sitting, I will look at the nipple line, looking for placement on the patient, kind of making sure that they're even. Also with the nipples, I will check for any discharge or any dry cracked skin. During this time when the patient is sitting, I will have them check for retraction. So I will have the patient put their hands on their hips and kind of lean forward a little bit and contract that muscle. That kind of helps us see the contraction there. While the patient is sitting, I will also palpate the breast, making sure to palpate all the breast tissue in this area, also up into the axilla, down the chest walls here. We have all breast tissue in these areas, up into this area, into the inner aspect of the arm. After I have palpated all of the breast and axilla area for any tenderness, lumps, bumps, edema, things like that, inflammation, I will go ahead and have my patient lay down. And again, I will inspect the breast, how they lay on the patient, making sure that they do not sit awkward one way or the other. And I would ask the patient if they're having any pain or discomfort with that. Again, I would palpate the patient's breast while they're laying down, making sure to use gentle circular motions all around the breast tissue. And we'll make sure to come up into the axilla. And also making sure we're getting the bra line area here. There's lots of extra breast tissue that we're not aware of, and lymph tissue as well. Getting the nipple of tail of Spence. At that time, there's lots of lymph nodes as well. We'll make sure that none of those are swollen. We have the supraclavicular and the infraclavicular, and some up in here. So I will just make sure that none of those are tender or swollen, and make sure that I'm asking patients any questions that would be necessary, making sure that they're not having any symptoms at home that they've noticed that I wouldn't notice during the exam.